I am small, but I cause big problems in your body. If I get into your body, what am I? Bacteria, microorganisms, viruses. Today I'll be demonstrating how to properly don sterile gloves without breaking sterility. 3 key points are clean hands, the right size gloves, and avoiding touching sterile areas with your skin. We as humans are host to many bacteria, many microorganisms, dirt, dead skin cells, and boogers. It's our job as sterile compounding technicians or pharmacists to prevent these bacteria from transferring to our patients. And one way to prevent that is to properly don sterile gloves. First, you want to make sure your hands are clean. Let's pretend my hands are already washed. Wash my hands and um, put my gown on and everything. Washing your hands eliminates 90% of bacteria. And after you wash your hands, you're going to want to sanitize, and that kills 99.9% bacteria. Right? And then you want to make sure your hands are dry, count to 10, sing your ABCs, do whatever you please. And then make sure you have the right size glove. Once you have the right size glove, you want to make sure it's not too tight and not too loose, because then you'll struggle, or you just won't be able to perform correctly. Think of it as trying to find the right pair of running shoes. Too tight, you're going to be uncomfortable. It hurts. Too loose, you're going to trip, stumble. You might even lose a shoe. Um, so we'll begin. You want to open the package carefully and place it on a sterile area. Make sure it is upright and facing you. I'm going to open it carefully. Make sure you don't touch the gloves. So the finger part is sterile. The cuffs right here, that's the part that's going to touch your skin. I'm going to use my dominant hand. Keep your hand as flat as you can and tuck your thumb in. And you'll hold the cuff like so, and then you just slip your hand in. Sometimes you want to mess with this, but you don't. We can do this later. The next hand, you'll grab the cuff here, and then you can use your fingers to touch the other fingers on the other glove. So I'm just going to tuck it in under here. Keep your hand flat, thumb tucked in, and then just fold it over. Now you can use this to fix the other side. Just tuck it in under and fold it over. And that's how you properly don gloves. I'm going to show you another way just in case you mess up. Okay. As before, open carefully. Make sure it's upright, facing you. And then careful, make sure you don't break sterility. I'm going to take the cuff, keep my hand flat and thumb tucked in. And then, so it it's kind of messed up there. Now I'm just going to leave it as is and try to, I can still touch this part. Keep your hand flat, thumb tucked in, and then I'm just going to fold it over. So, and then now I can use this hand to fix what needs to be fixed. And then tuck it under and fold it over. Right? So that's that. Um, because we handle sterile IVs for our patients, donning gloves is important to keep these bacteria from getting into the medications and into our patients' bodies. Um, although the process may seem small, but it has a huge impact um, to prevent any bacteria from getting to our patients. Um, this concludes this demonstration. Thank you for your time and patience.